The most common joint that gets arthritis in the hand is called your CMC joint, which is the base of your thumb, and it's where your metacarpal meets your carpal bones. It's probably the most common area to get arthritis. People often complain of pain at the base of their thumb. They have problems opening jars. They say that they're losing strength in their hands. With arthritis, it tends to be an older population, so probably 50s, 60s. People who have had a trauma to their hand, had a fracture in this area to their thumb can sometimes develop arthritis. A lot of times it's a wear and tear item. We make the diagnosis on clinical exam and x-rays, and then once we have that, we can try the non-surgical route first, which oftentimes includes just a thumb brace that people can wear for comfort. We can do anti-inflammatories. We can do steroid injections as well. And some of it's also activity modification, in that people will find that, well, writing hurts, but if they use a bigger pen, it's less stressful on the joint, so that doesn't hurt as much. The gold standard, which has probably been around for 30, 40 years, has been the tendon interposition. And so what we do with that is we make a small incision. We go in there. There's an arthritic bone that we actually take out the bone, and then we have a spare tendon in our wrist, actually, that doesn't need to be there in order to have a fully functioning wrist or hand. So we take that tendon and we put it in there as a spacer, and we kind of recreate the ligament. So we recreate that ligament to help stabilize the joint again. I will put them in a splint that immobilizes their thumb for about 2 weeks straight, and they just kind of rest their thumb. Afterwards, we take the sutures out, and then we put them back into a brace that they can now take on and off for showers, and then we start sending them to therapy. We have them start working on strengthening exercises with therapy. Usually by 10 to 12 weeks after surgery, most people can go back to their regular activities without need of the brace.